we felt like we needed to go back to the start and say, okay, what are the objectives of monitoring and evaluation, and what are we going to get out of it? Why are we doing it? And so we came up with 4 rather obvious reasons. The first, of course, is for the children, to identify immediate and urgent needs. And that can be monitoring them to assess immediate needs, but also to detect emerging needs. The second reason we thought M&E works is for donors and governments to provide accountability, and not just for accountability to them for their money, but accountability because they're acting on the behalf of the beneficiaries. And then for current programming, this is all about evaluation that we've been talking about, for current programming to inform modifications of ongoing programs, and this will be also useful to implementers, of course. And for future programming, so to inform and enhance future programming and what we want to do, how we want to intervene in the future, program design, and also to think about strategies that we could roll out in other settings after we trial something in one setting. Okay, am I good at this? Yes. Okay. There it is, our recommendations framework. So as you can see, we feel like research sort of informs practice and policy, and yet at the same time, practice and policy really need to inform research. And it was good that we did that because it goes directly into some of the next ideas. So we looked at policy, and our recommendations fall into several categories. We believe that M&E requires not simply more attention, but a more appropriate focus. So we want to advance towards a more sophisticated and complex understanding drawn from multifaceted assessments, not just exposure outcome. We want to look more at those mixed methods and get a greater understanding of context. Under policy, we also want to address the importance of policies that might help strengthen M&E methods and systems. And I'm going to focus, when we get to the slide, on a more well-planned use of data that's generated from monitoring and evaluation. Practice. So under practice, we will address more of the how-to. That is, we'll highlight simultaneous independence and integration of M&E throughout programming and practice. And really, especially from my work, the coordination of M&E with services, advocates, other researchers, and across sectors. And we'll emphasize the importance of realistic, sufficient financial, human, and technical resources for M&E. I know everybody agrees with that. And then, you'd think that list would be longer given that we were researchers, but research recommendations are pretty easy. And since it was around Christmas time, I guess we could have made this huge wish list. But we tried to focus it down to highlight future important trends based on some of the larger past gaps or future opportunities. Okay, so one of the important things my group does evaluations of complex social interventions. And one of the things we've learned, like everybody else who does evaluations has learned, is that you need to provide M&E design and funding alongside program design and funding in order to produce meaningful results. Particularly when M&E is a condition of the funding or the program. Now, this concept is pretty well accepted, but just to add on what's been suggested, if M&E results are to be meaningful and relevant, they must be incorporated into the design of the funding structure of the program from the very start. Policymakers must begin to consider M&E not only a way of measuring whether funds were well used, but as an integral and iterative part of the program. Post-project bean counting, yay, is thankfully over. And we're now not looking at how many posters were disseminated and how many children were using a given resource. So now we need a shift in thinking and planning to ensure that it's not only about potential impact, but also about the process of how things changed. And I think people have mentioned the what's inside the black box, and I think that's what we really need to be careful that we're not looking at exposure outcomes solely. We're looking at how we got there. Okay. Now, this could be controversial, but I'm going to say it anyway. I worked for a local NGO in Cambodia. I started a local NGO in Cambodia. And we were always, this was a long time ago, dinosaurs were kind of still roaming the earth then. And we were always asked to provide the reports on our activities and to measure things. I would have begged, borrowed, and stolen to be able to collaborate with groups who could do proper evaluations. Double burdening my staff, who were already providing services to some of the most vulnerable victims of domestic violence, going out there and producing the plays to try to change public awareness, really honestly double burdening them to count, to evaluate, to think about, to write up the reports is too much. I really want to urge people who are funding this, making policies about it, link us up. I'm now on the other side of the table. I work always with NGOs, and I wouldn't want to burden them. It doesn't mean not including them. Include them in the project design. Include them in, we always sit around the table and develop the study instrument together. We always feedback and pilot test it together. They even collect the data. But you need to pair the groups together. Otherwise, it's really double burdening the staff. Okay, now we'll move on. Okay, the other thing that I think we haven't been really good about is we haven't been clear about the M&E rigor required. And you don't always have to do whatever we consider the gold standard. I'm not going to use the word, I promise. RCT. But I think especially funders need to be clear about what kind of rigor they're anticipating and then, not surprisingly, fund it appropriately. And I think also we need to think about what we've all talked about, which is the timing. You're not going to get change over time if it's a short time period. If you want to check whether an intervention is working, you need to give it enough time to work, and you need to pay for that time so it can be monitored over the time. Okay, so Alistair presented this very well. I thought one of the things that we're missing clearly is for crisis settings, we need reliable, concise, proven assessment methodologies to help promptly inform on the scope and scale of assistance for children without family care. And we need to be able to do that in ways that we know is efficient. And then intervention effectiveness, we've talked all about this. We need to fund rigorous evaluations. We need to think about comparison and control conditions. We need to think about problems of contamination. And we need to think about randomization. And most importantly, again, we need to think about causal pathways changes, how we got from situations of adversity to whatever we're looking at as the outcomes. Oops, that's there. And then we need to think about, again, people have mentioned this over and over again, long-term evaluations and support that follows the different developmental stages and trajectories of children outside of family care or who get back into family care. Methodological approaches. Again, this builds on what we just said, which is you have to align the evaluation approaches with the project aim. And to do that, you need to coordinate with the groups who are actually doing the work. In addition to that, my group has had incredible success when we've brought advocates and policymakers in right at the beginning. Because then we know what evidence they're going to need to take it to the streets and take it to the policymakers. So we make sure to ask the question. So we have it in the survey or have it in the qualitative work. And again, we've had great success because advocates actually want to participate in this. Okay, we also have to have realistic measurement goals. So we can't be wanting more longitudinal monitoring, but always expect to get our very last aim of, for example, in our group, reduced violence. There are measurements across the causal pathway that we can use as proxy measures to consider whether we're getting there or we're moving towards the ultimate outcome we want. Adequate time frames and, of course, resourced sufficiently. Did my battery die? Ah. Got it. Oh, there? You're right, of course. Okay. Train implementers on the use of robust impact evaluation. So, again, people have mentioned this. we need to make sure that the people who are actually coordinating with us to collect the data understand very well what they're doing, how they're doing it, feel comfortable doing it, and don't get burnt out by actually having to do that work. And then, as Alistair mentioned, we need to pilot system-wide child protection and monitoring. And I'm sure he'll speak more to that if you have questions about that. Okay. No-brainers, yes, maybe, but not necessarily often adhered to. So don't collect data unless you know why it's needed and can imagine how it will be used. For example, in my own work, when we develop our study instruments and when my PhD students develop study instruments, I demand that they put a third column so that they can justify for every question how it's going to be used and why it's important. And if they can't do that, then we should probably drop that question, because we all know questionnaires get very long. And so we need to be able to know why we're asking the question and that it'll be analyzed. And then putting data to good use, and this is a really big point for me. We need to make sure that from the outset we understand what we're going to do with the data when we get it. You know, there's been so many studies where we collect the data, we produce the findings in a report, and then boom, done. We need to consider at the very start of an evaluation or monitoring program what mechanisms will be put into place to promote good and realistic use of the data that's collected. Now, that said, I want to also mention that the Research Council in the UK had really realized how difficult it was for researchers to actually make good use of their data. And so they've recently, 2 years ago, implemented something called a follow-on scheme. Now the follow-on scheme is an independent funding piece that you can apply for as a researcher to say, listen, I have all this good data and I haven't been able to do much with it with the groups I worked with. And then they fund however much for actually going out in the community, doing advocacy, doing training, making sure that the data gets put to good use. And I would advocate that both we need to think from the start how to use the data and also consider funding extra after the study's done. Rick, this is your picture. Very, very symbolic of what we really mean. You have to get M&E through design, and you can't retrofit it or tag it on at the end. Coordinate data and methods across sectors. So, basic lesson for children, sharing. A concept that we teach them, but we're not very good at doing it, especially working across sectors. So I think we need to facilitate better data collection and analysis by working across the different sectors. And I think somebody mentioned the other day about it helps us really avoid asking the same questions to the same people over and over again. And particularly when you're asking sensitive questions about violence, about trauma exposures, it's best to probably avoid asking that repeatedly over time. And then develop common and consistent measurement variables. So it's not to say to systematize everything and make everything the same, but at least let's try to work together so that we're collecting similar data so that we can compare what we've got and make sort of data more generalizable, the results more generalizable. I think one of the things I'd recommend is that we ask donors to bring together research and program teams to foster M&E information exchange and interchange so that we can start collecting similar types of data. And then mixed methods have been mentioned a lot, so I won't go into that. And then utilize well-informed ethical and safety protocols. So, sorry, that's the last one. So one of the recommendations we'd have is we can't just all live by, I guess it's IRBs here, for us it's ethical clearance. It's not just enough to get that through an ethical board. We have so many risks that couldn't be understood by an ethics board in the research that we do, especially with children. I work with victims of violence, women who are trafficked, and I can get something through an ethics board, but I know the range of risks, that it's much wider than that. And then when you get to the context level, it's even wider than that. And so I would suggest that our group our group promotes this idea that we should have actual research on ethics and safety. And one of the things that we have done for our work on violence is we have actually developed specific ethical and safety protocols for the populations that we work with. And I would say that that would be useful for children. We've talked about resilience, can't be said enough. You're not going to be able to come up with intervention programs that build on positive influences unless we know what they are. And so I think we really have to explore risk and resilience as well as children's processes of adaptation. So it's not just, again, about exposure and outcome, but it's also about how did they get there. And then it's an odd thing, but I think we have to explore potential positive aspects of children's high-risk situations, which means that we need to think about, while we all know we'd like children to be in the safest, healthiest, most loving families, that's not always going to be the case, and sometimes children find the benefits or empowerment or situations of coping that are good in the situations they're in. Because I work on violence so much, I'm confident that there are many children who are not in their families because it was very violent, and they might be safer where they're at, and they might find benefits in the situations that we would consider high risk. Use child-focused participatory methods and foster mechanisms for feedback to children. I think that's really important, and I know that the people in the room would know how to do that better than I would. So when you use your green cards, please, if you could make recommendations about how to feedback information from findings in child-friendly ways, I think that would be a useful thing to do. Really obvious points, but so not done. There's so much asylum data that I've been looking at that's not sex disaggregated. How that's possible, I don't even know. But I think we all really need to commit to making sure that everything we do is sex disaggregated. And I would build on that by even saying that we have to, when we're looking at sex disaggregated and gendered influences, we need to include violence. I was talking to somebody at my table yesterday, and she said, do you know the main reason why most of the kids we interviewed were no longer in their families? Violence. We really need to start asking about violence. And not only that, but it's something that people need to be trained to ask because it's hard for people to ask. And so if we're asking the NGOs to ask about it, we need to give them support to be able to do it. We talked all about data being age disaggregated. And I couldn't have been happier when yesterday somebody mentioned the idea about explore migration-related features. So I work a bit on migration, and we came up with this model. And it's really important because the populations we're talking about who are outside of family care are generally mobile populations. And to understand what's going on with them and what influences how they are, and most importantly, when and where we can intervene, we need to think about the different trajectories of how they move. And so I think we would advocate for looking at pre-departure influences, what happens when they travel or move, their destination locations, interception being sort of situations of detention, refugee camps, in my work, immigration detention, and then look at also the trajectory for return. Not just that they are returned, but how are they returned? And that really brings up the model that we use also for trafficking, where return turns into integration and reintegration. And then there's a little line that also goes up and says re-trafficking, which is very unfortunate. Okay. Most of these everybody has said, so I'll just sort of fly through them. We need a wider range of intervention options. We need to think about how to sustain proven interventions. We need to think about whether interventions have potential to be applied in a different or larger context, and whether and how interventions that are effective can be taken to scale. And then I just wanted to have a quick minor disagreement with Alistair. My group did some intervention work in South Africa called the Image Project, and it was to reduce violence against women, specifically domestic violence. It was a microcredit program combined with an empowerment program. It was a 2-year program with monitoring and evaluation to do cluster randomized controlled trial. Within the life of the program, I kid you not, it's all documented, it's in the Lancet, you can find the study. Within the 2-year life of the program, they reduced domestic violence by 50%. That is not insignificant. And I think that I completely agree that it's a complex set of factors that put kids at risk, and it's a complex set of factors that actually will get them out of risk. But that doesn't mean that there aren't programmatic approaches that can be really sort of targeted and effective and that we can measure. So I would encourage thinking about that. And in addition to that, I will tell you that they did a costing. There we go. They did a costing of it. And it's now going up to scale all over Tanzania. And they will still be doing a costing of the scale up as well. So it's definitely worth doing that. Develop evidence on what are useful roles for caregivers and care workers and community stakeholders, and tracking and reporting about vulnerable children. We need to know what incentives will foster independent and lasting community-based monitoring. And again, I think this has to do with also thinking about compassion fatigue and how we're going to support our supporters. So again, this is the final slide, I promise. What we're trying to look at, all of you have said in all your comments, is very complex, and it's a really complex interaction between all these factors. But we need to think about children's movements. Importantly, we need to understand what we mean by exploitation. It's a term that's thrown around a heck of a lot, specifically in the trafficking world. In fact, it's the central component of the definition of human trafficking. And yet, how exploitative does something have to be considered trafficked, and exploitative in what ways? And then for child labor, which again is not my field, I work mostly on trafficking, but I understand trafficking for child labor. We need to explore what we mean by exploitation in cases of child labor in order to begin to address the debates that I've heard raised by practitioners in the field around acceptable and unacceptable forms of child labor. And again, it's a debate that I'm sure it's out there. I don't engage in that particular one, but certainly exploitation isn't always 100% bad. Actually, people benefit from certain circumstances even when they're exploited, and maybe it was better than what they came from. And then the issue about the complexity of cumulative risk exposures and protective processes and various outcomes and how those all sort of interact with one another. And then that slide, back to the first one, because we thought that you might want that up there to think about some of the further recommendations you want to make.
Thank you, Cathy. Well, you put a lot of provocative things on the table. What's the response here? What comments? What are people thinking? Because I still have people thinking. Go ahead. Gillian.
I talked a little bit in our core group as we were planning this that ideally focal question 1 and focal question 4 would come together, and I was just wondering if you've given that any thought and how that circle might be joined.
Enumerating.
Yes, I was slightly disappointed. I wasn't here for the discussion, but I've read the paper, so I can see that connection. My hesitation in a way, so I think there was a discussion with John Grizzo, number 2 and number 3 joining in, and I think there's a sense to which there's a knot of issues here, and it's the, I think I would come to that in terms of looking forwards of what's the story that needs to be told and to whom, to decide the best way of structuring that, because I don't think any of the focal questions are completely independent of the others, that they're touching similar issues, and I think clearly evidence, data, information is central to everything that we're discussing. So I'm agnostic on whether the 1 and 4 join is particularly more acutely relevant than the 2 and 3 join, or the 4 and the 2, or whatever. But I think the idea of connecting so there's a coherent story, and that the way it's structured depends on who's being targeted with what's the message.
And one other comment on that, it could be that in the next round of evidence reviews, you have a different configuration. This will take us to some point, and then someone else will pick it up from there. And maybe there'll be a different mix. Something we could talk about later. Other comments or thoughts? Go ahead. There's two right there, one right after another.
All right. Thank you very much for the presentation. When we come to the level of making recommendations, there is something that again has crossed my mind. One thing we need to realize is that the quality of monitoring and evaluation practice across many civil society organizations is still very, very poor. And I think on the basis of that, then we can make some other subsequent recommendations. And the reason I'm saying this is that based on experience, many organizations, are very ambitious. They develop logical frameworks that have indicators, some of which require, population surveys when you look at inputs, outputs, and outcomes. But when it comes actually to allocating resources that will enable to generate that data, the resources allocated are minimal. They cannot help that one to be achieved. So in a way, it means that on one hand, these organizations have come to a level of appreciation of the importance of this information, but they don't have that understanding of the methodological implications and what would be required to generate this evidence. And I think when it comes to building the capacities of organizations, this is a very, very important aspect, because they come up, with many exciting things, but when it comes to measurement, how to generate this information, then the methods and the resources allocated do not match. So it needs to be given attention.
Want to respond at all?
I was just going to say, I know Cathy agrees with that, and I do as well, in terms of the discussions we had around recommendations, the sense to which there needs to be a reality check in terms of the ambitions of complexity and what that really means in terms of financial resources, but also capacity and so forth. So I think the discussions in the group were about setting the vision appropriately, which is that if that's an important thing to put in your log frame, then it's an important thing to want to collect information on, but to realize that we're not going to get there tomorrow, and what are the ways that we can begin. And I think there's a number of good examples I know from around the room of building regional capacity and using local universities in terms of partnership with NGOs in the way that Cathy was talking about, and again reflecting the discussions of the earlier session today about that sort of partnership that is South-South, North-South, NGO, university. That's a sort of network of capacities that we need. And
I was just going to add to that, that as I briefly said, that I think donors and groups themselves need to be clear about the rigor that they require. And so if you require really a cluster randomized control trial, which you may or may not need, then unfortunately those are incredibly expensive and may be more expensive than the intervention. And at the same time, you may decide that you don't need that level of evidence, and you can fund something that doesn't take as much time and isn't quite as rigorous as that, as long as that's the level that everyone agrees from the start that you're willing to accept, and that you can present the findings of that study clearly with the limitations that were on it.
Get a comment over here.
Yeah, thanks. It was very interesting, and it really just feeds into what you're saying and this gentleman said. I would urge you also to bring in the communication teams when you're designing this. I work in communications at UNICEF, and it's often the missing piece, because journalists want that causal pathway that you're talking about, not the end impact, and it will help us tell the story, which will raise funding.
So I'm really glad that came up. It hasn't come up very much throughout this, but the translation of all this research into policy and practice, policy particularly, won't happen if we don't do that.
And also, obviously, the explosion of digital and social media, it makes it a lot easier, because data is really needed, and you can disseminate data a lot better. You can do it really quickly. You can do fantastic infographics as well, which your brain can take that in much easier than lists of text. So do share this information.
Okay, one last comment before we go into our groups.
I'm Vicki Walker from Windrock International. I wanted to bring out also, and this could pertain to the other groups and to the holistic approach, but maybe based also on what Anita was mentioning yesterday. I think that in terms of monitoring, especially community-based monitoring and looking at sustainability systems, particularly in rural areas, that we need to also consider the private sector, companies, corporations, industry who are engaged in wanting to be sure that their supply chains and that their responsibilities are being observed. And they need NGOs and they need organizations doing research to help with that, but I think also as sources of resources, and also to help with making sure that the monitoring systems are serving needs to reduce child abuse and also child labor.
Great. Well, this has been a very productive and enriching conversation. We're going to go into about 20 minutes, 25 minutes of small groups while we're waiting for lunch to come, and then we'll come back for a little bit shorter time and then move into lunch. So the questions now are, what from this presentation leads you to a series of recommendations that we can capture on your blue cards? Thanks.
Okay, and Cathy needs to make one clarifying comment, I guess. Okay, go ahead, Cathy.
Okay, so I've just been informed after I made my little, very brief and not well explained comment about exploitation that a certain unnamed politician who I'm not very fond of made some comments about child labor laws. And I want to say that A, I did not know anything about that, and B, that's not at all what I was implying, so please do not make that connection. It is erroneous. Thank you.
Okay. Anybody who would like to share their after that? Libby, you want to say something here? Libby? No. Were you going to say something? I thought you had your hand raised. No. Okay.
Thank you.
Go ahead in the back. Both 1 and 2.
Well, it was basically, I think, probably a question to Alistair in a way about the way you approach this, and it was observing that under project evaluations, or the category of project evaluations, first of all, out of the thousands of evaluations that are done every year, and that must come to hundreds of tens of thousands at least over a period of time, we've only got 11 in that box. So is that 11 project evaluations, or is that 11 evaluations of evaluations? Is one question. So why is that number so incredibly low? And surely there has to be evidence in those evaluations. Otherwise, are we not completely wasting our time? I mean, we're all, certainly on the operational side, doing lots of evaluations, and we all hope there's some learning in them and so on, and we take learning from them. So are you implying that we should stop doing them because they're a bit of a waste of time, or is there something worthwhile in them? And then the second point, I suppose, was about, do we not need to unpack that category of project evaluations anyway? Because that's simply an activity, but actually what's inside that is a very diverse range of approaches to project evaluation, and the way in which they're done and the way in which they're analysed and so on. So trying to put even 11 in one box is surely misrepresenting the nature of that activity and the kind of what's in there. So it's really just trying to understand what those 11 stand for, and whether or not that category of project evaluations is a terribly useful one.
Alistair?
So thanks, Bill. So to take those in turn, so we've signalled this as a preliminary paper, I think, as every group has, and I think we've acknowledged that filtering that we noted in terms of numbers of papers. So I am sure, as every group is, that there is relevant evidence that escaped this filter. And so I think what we really say is that the filter that led us to where we are gives us some impression of that field, but it's certainly not a conclusion that there are only 11 decent evaluations or whatever. They are the things that came through that filtering criteria that was agreed at the pre-summit. So I would see it as a sample or an insight into a much broader range. But then to link that, this would not be that diagram is an attempt to do, in a sense, what you're touching at, to reflect on the diversity of approaches to measuring things at different times with different groups, etc. It's not meant to put a box and saying everything's the same. So, for example, in that group, it's a remarkable range from the impact of sulfur tablets on scabies to promoting psychosocial engagement of care workers. So it's a huge range. And within that, there's just a common element, I think, and linking it to some of the discussion earlier, of basically looking at exposure to a particular circumstance and then seeing the impact of that. And I think one of the things I'd want to draw from it in terms of that right hand of the diagram, in terms of some of the complexity, is to unpack that whole area of project evaluation, so that it isn't just a question of did this have an impact on that target variable, but to tell the story, the pathways, the trajectories, which is often beyond the scope of perhaps a single conceived program evaluation at the end of 1 year, 2 years, or whatever, but it's really following kids through in the diversity of their circumstances. So to summarize, this is just a sample of the studies given the methodology that was adopted and agreed at the summit, and I'm sure it's the same for other groups of what comes through. And then secondly, that I think there are areas, as you're hinting at, for further elaboration and discussion in terms of, okay, there's a range of approaches there. What is the methodological and the features of those that we would want to replicate and to explore in other settings?
Go ahead. There was somebody right after you, and then I'll go ahead.
I'll only go now because just to comment on, originally the question was, our task was, as a member of Focal Question 4, to find out what the evidence was for how do we do evaluations most appropriately, and what's the evidence for doing monitoring. And that was difficult. There really wasn't evaluations of what's the best way to do evaluation in this particular circumstances. But that, in fact, was our task, and what we were trying to pull together. And so then, even though we had various people when they were doing the sorts in all these different articles and hundreds of thousands of articles that were originally read, was to sort to which ones have some relevance to how we do monitoring evaluation. And so that's how they got clustered. But ultimately our question still is, what's the evidence for what's the best way to do evaluation and what are the particular parameters about why that at that time, and the same thing for monitoring. What's the evidence that monitoring is effective in particular times and places?
Great.
Thanks, Cathy.
Go ahead.
I'm Kate Yoon from the University of Pennsylvania. I'll do my best to reflect the animated discussion in our quite diverse group, and they really build on these points.
And I'm going to ask you to speak just a little bit louder.
Perhaps be a bit taller. So we had some thought questions. Are there specific models or examples for monitoring and evaluation methods that might be best suited to particular contexts, program types, or vulnerability groups? How does one disseminate and translate M&E methods that have been feasible and successful in one setting to other settings? What principles would guide funders and practitioners in selecting appropriate M&E approaches based on these existing methods? Are there detailed descriptions of how one approaches specific M&E methods for vulnerable children specifically? And finally, what is the role of global indicators in M&E for this population? So all very easy questions, and except very crisp answers.
Great questions. Cathy, I don't know if you want to respond to any of those. No? Or Alice?
I'll have a shot, and I actually want to pick up on something that Cathy was saying, and I think if you go back to that guidance document that we reviewed, there's now, I think, a developing literature of advice and guidance on the selection of appropriate evaluation and monitoring methodologies. And one of the things I think they generally share in common, I'll come back to the global indicators thing, is that early stage negotiation in terms of what is the vision or the notion of implementation. And so I think rather than having, and that goes back to Rick's diagram of retrofitting, that if monitoring is part of the design process of implementation, a number of the questions that you were addressing becomes set by that agenda of implementation. What is the targeted change? What are the concerns? What are the protective factors? What are the forms of resilience we're seeking to promote? And driving it that way, then looking tools that suit that purpose. So I'm just flagging that it seems to me that rather than feeling that the evaluators come in with their box of tricks. It's very much a question of partnership right from the stage of design to clarify what the objectives of programming are, what the mechanisms, the model of change, the causal pathway, those sorts of things, and then to draw upon developing expertise. And I think some of the principles, it's a design issue, I think, in a sense, really, often of choosing from a range of potential methods what matches that proposed implementation strategy.
I do think our group also had a little bit of difficulty trying to think about both and. So the idea that there's an evaluation, but also then there's this general idea of monitoring. And they're different. And so if you want a government monitoring system, how are we going to think about that? And so I think we tried to juggle a little, but maybe not very successfully, more focusing on the evaluation ideas than the monitoring systems.
Other comments?
I'm a little taller. Alex Blum, NIH. I'll just talk about one of the aspects of what we discussed. So we brought up the point, or the point was brought up about developing outcome measures when we talk about evaluations. And so perhaps because there's a few health services researchers at the table, that when we look at health data, we now are getting to the level of sophistication in this country where we have developed quality measures that are based on data. But in the conversations that have been happening over the last 2 days, there seems to be a lack of kind of clear definitions for the outcomes and the goals of the outcomes. So for example, when we talk about successful adoption, what does that actually mean? Is it simply the lack of children running back to their institutions? Is that the outcome we're looking for? And if that is the case, are we talking about within 6 months or a year? And so getting to the sophistication where we're developing outcome measures that are based not only on kind of expert opinion, but eventually really based on data.
Just a brief comment on that in terms of the previous question, that it seems that question of what does successful adoption mean then is an implementation question. Certainly evaluators, researchers can help tighten a definition, but it seems to me that what we're saying is that this is not a separate activity. It's for the field to determine what the programmatic priorities are and then to work in partnership to identify ways of effectively measuring that. Now I think in practice as the field grows and the language, there's a development of a community of language, it becomes easier to share measures and tools that have been used elsewhere. But I think there's a real danger of sharing the tools and measures before the implementers, programmatic people, policymakers are clear what they're trying to change. So that was the point from the previous comment, that I think I would hope that we would follow the model of the health sector where there are a move towards some global indicators in terms of key health indicators, but those have bubbled up from practice, not just in Geneva and New York, but in country offices, in programmatic realities, such that there's now a conceptual framework to join a community language of practice. And I feel we're not there yet in a number of fields within child protection to be knowing exactly what we mean. And it's partly a cultural contextualization issue, but I think it's more than that. And your example was a good one in terms of what a successful adoption might mean. It's not just about cultural adaptation, but really understanding for the field, if we use that phrase, what different agencies, different governments might perceive to be its goals in terms of supporting adoption.
So this is kind of the evolution of a field in some ways. I mean, we've seen it here as Bob goes to the microphone. You know, it took a long time to have safety, permanency, and well-being be the outcomes of child protection system here and a framework for legislation. But what that's going to mean in every country context, I think, is going to vary as these develop. Bob?
So just to argue a bit. I mean, if you're going to design a trial, say comparing two methods of promoting adoption, and you want to design a rigorous trial, you might even have a controlled trial of some sort, you have to have a primary outcome measure in order to design the trial statistically, to have the adequate power to measure it. You can utilize very powerful statistical tools like survival analyses and things, but it requires the pre-specification of a primary outcome measure. That doesn't mean that there wouldn't be a whole bunch of other stuff that you would measure with respect to that adoption. But you have to leap in and sort of use your experience to figure out what would be a meaningful outcome measure that we could consider a success, because otherwise you're not going to really be able to design the kind of controlled outcome trials that you would need to do real solid efficacy research.
I think that's true, and that's definitely been our experience where we have to select an outcome for control trials. But again, I would emphasize being very careful that while the outcome you really want ultimately might be all children in school or more children in school, that unless you're going to give the programmatic time to make that happen, you better choose an outcome that you actually think could happen within the time frame of the program you're evaluating.
Good point.
And just to build on that, I think in terms of the you choose, it's back to this notion of who's the you, and I just want to get away from a notion that somehow evaluators independently get an indicator off the shelf. Whereas we need to, I think that's come out of all the morning and from what I understand yesterday's discussions, it's for the field to shape an understanding of what it's seeking to do in partnership with researchers and evaluators. So I absolutely agree to do that design, but a precondition of it is that implementers and policymakers who are funding the study have some notion or are encouraged to articulate what success would look like. And it's not for researchers to do that independently and fussily, but in partnership.
Lee, last comment before we break.
Yeah, our table's been having this recurrent theme across several of the papers, and if we have a vision of protecting children so that they can develop and have a sense of well-being, and we assess and come to a standard across the field of well-being and what that means, both in terms of their development band and normalized to their age, that incorporates the whole child, their mental health, their physical health, and their psychosocial status, which we know some of those parameters as well in terms of connection to loving adults. It seems to me if we assess across the identification and their initial needs, and then over time as they grow while they're in their long-term environment, and we monitor that, then there is something that we can agree upon and we can measure. And it doesn't, and to some extent education, is part of that well-being. So it seems to me that we in our country we have rating standards for third graders, and so that's what we measure up against. So if we agree upon what the well-being is and how to assess that, what the tool is, then we could standardize across all of these cohorts. And it may be over time that we identify that certain types of adversity lead to certain outcomes, undesired outcomes like post-traumatic stress or depression, and then we can begin to see how we can meet those needs in a more systematic way. So I don't think we're that far off as a field, because we do see child well-being as tied into normal development measures, and we know what the components are. So I think we're not too far off.
Just again, in this debate, there's much of what you say that I agree with, and I think I'm on a middle of a continuum with colleagues in this field. From I'm going with Nicole this evening to Ethiopia to look at interventions that World Vision are involved in and to identify what a successful intervention would look like. And I have on my laptop some existing measures used in other projects, but I take that with some concern of a process that we'll be engaging in. Is that what well-being really means in this refugee camp? And I'm not so far at the other extreme to think that there's nothing I've ever done anywhere that is of no use in that discussion. But it seems to me that there is an engagement. It's not just about culture. I mean, we've done work around parents and children defining well-being in different contexts, and it is quite different, that subjective nature of what a successful life is, what a happy childhood childhood is. I'm not defecting to a complete relativistic camp when I say that, because I think we do need to develop some general approaches. So I think we're in this messy place in the middle where we need to find commonality, we need to find a common language, but we need to acknowledge that when we're dealing with children's well-being in and out of families, that is culturally constructed and it's done differently in different places, and we somehow need to reliably and validly grasp that. And so that it's a complex balance between those. But I think it's achievable. I agree with you.
I can't imagine a better note to leave on lunch than a child well-being frame for the conversation. And thank the panel here before you go to lunch.